Hello, this is Gabby Simons here. I am here with Nutrition for Addiction, which is a resource center for any provider, professional working with people with substance use disorder, whether in a harm reduction capacity where abstinence isn't necessarily the goal, or in a recovery treatment. So I want to talk about the concept of food addiction. Food addiction in the nutrition space has been pretty controversial for a while, especially in the space, in the eating disorder space, where you might hear things like all foods fit, and the intuitive eating principle of making peace with food, which includes unconditional permission to eat all foods. And so food addiction has been seen, let me take a step back. I'm giving a little bit of a background on the controversy, but then I'm going to talk about some things I just learned and how food addiction, I think, can be really helpful to know about and relevant to people with substance use disorder, because the research shows that, like eating disorders, food addiction also is highly co-occurring. So first of all, food addiction is not yet recognized in the ICD or the DSM. It may be in the future. I know that the researcher who developed or co-developed the Yale Food Addiction Score, the YFAS, is currently working on submitting food addiction for consideration by the DSM. However, there's a lot of research on food addiction that makes a strong case for its validity. And it's not addiction to any food. It's really the addictive qualities of what some people call ultra-processed food or highly processed food, particularly foods that tend to be high in refined carbohydrates and in fats. So foods like cookies, pizza, ice cream are some of the higher ones on some of the foods that rank higher in addictive qualities. And not everybody has food addiction, just like not everybody who smokes a cigarette gets addicted. Not everybody who drinks alcohol develops alcohol use disorder. Okay, so not everybody who eats these foods faces food addiction. The numbers that Dr. Gearhart, who developed the Yale Food Addiction Score, shared is that about 14% of the general adult population might have food addiction, or ultra-processed food addiction, we should say. So the reason that it's been controversial in the nutrition world, and specifically the eating disorder, all foods fit mentality world, is because of this idea that we need to, because of the idea that restricted eating or dieting, or what's called restraint in the research, leads to overconsumption or binging. So this idea that if you say carbs are bad, I can't eat carbs, and that will lead to, maybe avoiding them for some time, followed by overconsumption or binging on those foods. And so it's kind of this causal idea that restriction causes overconsumption or binging. And so the concept of some foods actually being problematic for some people or addictive for some people is contradictory to that exposure therapy that is sometimes used in treating eating disorders of let's face the fear food and let's get habituation with it, meaning let's make it less novel, less exciting, and therefore it won't be a food that you'll feel out of control with over time and with repeated exposure, and by allowing yourself unconditional permission to eat that food. So with food addiction, there's a premise that it's food addiction, or it's addiction to a certain food that causes people to then restrict the food. So it's sort of flipping that a hypothesis on its head. And, there is some research that shows that people who restrict certain foods do so because they meet criteria for food addiction. Okay, so how is this relevant in substance use disorders? Well, one thing that's really important that I'm sure we all know is that substance use disorder is co-occurring with many other mental health issues, and including eating disorders and including food addiction. And so if we ignore those other conditions, it's likely that there's less of a chance of harm reduction or less of a chance of recovery. For example, if somebody has poor body image, to the point of it being really preoccupying, and that desire, poor body image drives a desire for weight loss. Well, if that desire for weight loss is causal to the person using stimulants, which are known to lead to weight loss during use. So if someone starts using stimulants because they want to lose weight and because they have poor body image, if they're in treatment later and we ignore the poor body image piece of it, it's likely that still is there. And if the person gains weight, which is quite likely, there's a stronger likelihood of relapse. Okay, so we can't ignore these co-occurring issues. So if somebody has food addiction, and bear with me because I'm kind of thinking how I'm going to say this through as I'm saying it. If somebody has food addiction, they might, blame themselves. Why am I eating all these high sugar, high fat foods? But the reality is that the reward systems in the brain between substances, drugs and alcohol and cigarettes, and highly processed foods are very similar. And the research shows that these highly processed foods, they stimulate the reward centers in very similar and comparable in magnitude ways to cigarettes. Something like cocaine has a much greater effect, for example, on dopamine than highly processed foods, but it still stimulates those brain centers. So this is important because in general, if someone feels like they have no control and they can't stop eating a certain food, which you may see or hear in your clients and patients, we want to validate their experience. They may not have food addiction, but also it's valuable to know about this screening tool, the Yale Food Addictions screening tool, YFAST. And just to ask somebody, do you feel out of control around certain foods? What are those foods? If those foods happen to be, which they likely will be, highly processed food like chips, candy, chocolate, that kind of thing, you can really empathize with them and validate that. The food companies, these are all not foods that are found in nature. These are foods that are produced and processed. And the food companies that are making these foods have a very profound and high interest in getting people to not be able to stop eating them, right? They hire scientists to make them craveable, to reach that bliss point, to even to override or bypass or hijack some of our satiety and hunger signals. So we can validate people's struggle with those foods. And then, this research is new, and we don't have a lot of proven methods for necessarily how to therapeutically work with people around this. But for some people, saying just eat it in moderation might feel like invalidating. How am I supposed to eat that in moderation? I can't eat it in moderation. I lose it, and I just eat, if I'm going to eat a donut, I'll eat a whole dozen donuts, right? So hopefully we will get methodology to work with this, and it doesn't have to be all or nothing. It can sort of take after the harm reduction stance we have with other substances of addiction, or other addictive substances, where maybe we identify triggers for where the substance or where the food will be overconsumed, or emotional triggers that lead to the overconsumption. And we say, okay, if these triggers are happening, it may not be the right time to try this food or to eat this food. If someone has food addiction, for someone else, it may not be food addiction. It may just be needing to get out of the diet mentality and have unconditional permission to eat. So I think as I'm speaking about this, I need to make a video about intuitive eating and about unconditional permission to eat, and also another one about food addiction and how those two things are different. Okay, so to sum this up, as always, it's important to ask your patients and clients about how they feel, how their eating habits are. Are they eating regular meals? Do they have any concerns about their eating? Do they have any concerns about their weight? And ask them regularly, because these concerns and issues with eating, body image concern, weight concern, concern about loss of control with eating, these things can all be problematic or relapse triggers if they're ignored. So thank you so much for watching. Please follow our channel or subscribe to our channel, Nutrition for Addiction. If you want to continue to learn more about nutrition and eating behavior and how it relates to substance use disorder. And I'm really hoping in the future to invite guests on and to expand this platform. We also have a free downloadable handout folder. It's a Google folder, so you can find that. It's a Google Drive where I give access to handouts that you can use with your patients and clients. So I will link to that in the notes. And I'll also link to a place where you can find the great talk I listened to today by Dr. Gearhart about food addiction. And you can follow us on Instagram at Nutrition for Addiction. That's Nutrition, FOR Addiction. Thanks. Have a great day.